frozen embryo transfer means like we have frozen your embryos in a cycle. Once we have taken out the eggs, we have mixed it with the sperm and we have frozen it. Fresh embryo transfer means in the same cycle when we have retrieved your eggs, we have mixed it with your sperm and we are putting the embryos in the same cycle. So basically many times it depends that in which patients we should go for fresh embryo transfer and which patients we should go for frozen embryo transfer. But definitely there are studies nowadays which show that a frozen embryo transfer has got a better success rate than a fresh embryo transfer. Because what happens whenever we are doing a fresh embryo transfer, many times the patient is not comfortable because her eggs have been picked up few days back. Many times the patient is in OHSS, or many times the uterine lining doesn't come in the same cycle. So in those cases obviously a frozen transfer is recommended. But we have seen many cases when pregnancy has come in fresh embryo transfer also and it is mandatory. Like a patient whose endometrial lining is not being made with normal medications. Then what happens, many times we have to give them drugs, ovulation induction drugs to make the eggs, because these eggs will enhance the lining. So obviously in these kind of patients we prefer doing fresh embryo transfer. Secondly, many patients who have got multiple cycle failure. I have also seen this in my career in many patients who have got multiple cycle failure and they have had all frozen embryo transfer, but in the cycle with fresh embryo transfer they had the result, because many times the egg that is formed, that also boosts your implantation. So basically it differs patient to patient whether we should go for a fresh embryo transfer or a frozen embryo transfer, and every patient is different, like everybody's body is different. So it is better that you let your doctor decide that whether you should go for frozen embryo transfer or fresh embryo transfer, because there are several studies which support frozen embryo transfer and several studies that support fresh embryo transfer. We care about you.